posterior lumen dissection କରିନ ଇଣ୍ଡିଆରେ କେବେ ନି ହବାର ବୋଲେ बेस कहीं को लगा बोले काटी कुटा हवा तो केड़े हाथ ते
कहार हार्ट है
एटा संडा मन सुनो तो
हां डाउट लागु
हैं हाथी रखता है
हाइपरट्रोफी है
कैमरा सही तरीके से लगे चक्का
सीटी पड़ी जाए धूक आवाज कर काल पे गुटे आउट करने के लिए इसी वीडियो में मिस तो अच्छी होता है
Okay, so right. So what I will try to demonstrate first, the structures which are being seen grossly. The structures which are being seen grossly. So this will be the anatomical position of the heart. This will be the anatomical position of the heart. And if you see this, what is this particular structure called as? What is this structure of the heart?
Apex.
That is the apex of the heart. Okay. Now, the very important question is, the apex of the heart is formed by which chamber of the ventricle? Or which chamber of the heart?
Left ventricle.
Formed by the left ventricle. Right? Next. So please remember, the apex of the heart, it is formed by the left ventricle. That is the first important point. And the next important thing you need to know, right? Where will you feel for the apex of the heart? So everyone is aware of this particular method called palpation, right? So what is that you will be doing in palpation? So you will be palpating for if there is any heart sounds. If you will be palpating for the apex, right? You will feel by placing the hand over the chest. Now, in which intercostal space you will feel for the apex of the heart? Can anyone answer? Not fourth. Anyone? So you will feel for the apex of the heart in the fifth intercostal space. Understood? Fifth intercostal space of which side? Right side or left side? Left side. Okay. So we feel for the apex of the heart in the left fifth intercostal space. So left fifth intercostal space is like too big, right? So where? In the parasternal area, midclavicular area, axillary area, scapular line. Where will you feel for the apex? In the midclavicular line. So you should be very specific, right? So the apex of the heart is being felt in the left fifth intercostal space in the midclavicular line. Okay? And what will be the normal apical impulse? This particular normal apical impulse, how do you describe the normal apical impulse? Normal apical impulse will be it will be touching. We call it as tapping type of apical impulse. We call it as tapping type of apical impulse. Now, if you see the abnormalities related to the apex of the heart, abnormalities related. So, what is the normal character? What is the normal character of the apex of the heart? It will be tapping in character. So, you will be just feeling the touch. You will be just feeling the touch, and that we call it as tapping in nature. Okay. Now, what are the abnormal characters related to the apex of the heart? What are the abnormal characters related to the apex of the heart? The abnormal characters, we have two important abnormal characters. One we have heaving type of apical impulse. Second, we have hyperdynamic type of apical impulse.
Giving just
Right? What is the normal character? See, I want everyone should be answering. Right? If I don't get the proper reciprocation and I don't get proper interest to teach you. Right? So I teach, I will ask. So you should reciprocate me. Then only I will get interest more to teach you. Okay? So what is the normal character of the heart?
tapping.
Tapping type of apical impulse. Now, the two abnormal characters like what we have is
Having
heaving type of apical impulse and hyperdynamic type of apical impulse. Heaving type of apical impulse is due to pressure overload condition. I will repeat again. Heaving type of apical impulse is due to pressure overload condition. Hyperdynamic type of apical impulse is due to volume overload condition. Right? So what are the two abnormal characters?
Heaving
and hyperdynamic.
hyperdynamic.
Where do you get heaving type? That now pressure overload. Then I come to that. Okay. And where do you get this hyperdynamic?
Volume.
Overload. Now you need to know, right? Now you need to know what is the pressure overload conditions. What are those pressure overload conditions? Very good. So pressure overload conditions are aortic stenosis, where the aortic valve is narrowed. One more pressure overload condition where you can have is in case of hypertension. In case of hypertension also there will be development of left ventricular hypertrophy. So tell me the two abnormal characters.
Aortic stenosis.
Two abnormal characters of the apex. Heaving and hyperdynamic. Where do you get heaving?
Pressure.
Pressure overload. Where do you get hyperdynamic?
Volume overload.
Volume overload. So pressure overload conditions are aortic stenosis and hypertension. Aortic stenosis and hypertension. Then the other one is, and in case of heaving type of apical impulse, then sir, how it will be? Right? Tapping, you said like it will just touch. But heaving, like how do we appreciate? When you keep, see, how do you feel for the apex of the heart? You have to feel for the apex of the heart with the tip of the finger. You have to feel the apex of the heart with the tip of the finger. Very, very important. Okay? And in heaving type of apical impulse, you will have a sustained uplift. Whereas in how much, what is the normal character?
Tapping.
Tapping. Just it will touch and go. But whereas in heaving type of apical impulse, you will have sustained uplift of the apex. What is that called? Heaving type of apical impulse. Understood? Yes. And it will be in the same position, left fifth intercostal space in the mid-clavicular vein. It does not change. But whereas you take the hyperdynamic type of apical impulse. Hyperdynamic is due to what? Volume overload. What are the conditions where you will have volume overload? In mitral regurgitation and as well as aortic regurgitation. Mitral regurgitation, aortic regurgitation. There you will have volume overload conditions. And in case of volume overload conditions, you know what will happen to the apex? Apex will not be in the same position. Apex, it will be shifted down and out. I'll repeat again. Hyperdynamic type of apical impulse is due to volume overload condition. And you see that in mitral regurgitation and tricuspid regurgitation. And the apex will not be in the left fifth intercostal space. It will be shifted down and out. That is what is the hyperdynamic type of apical impulse. Okay. So last time we will revise. Okay. Last one time about the apex. Normal character. Everyone should answer, please. Everyone should answer. Then I will be happy. Okay. Normal character of the apical impulse.
Tapping.
Tapping type of apical impulse. What are the two abnormal characters? Heaving and hyperdynamic. Where do you have heaving type of apical impulse? Pressure overload. Hyperdynamic type of apical impulse? Volume overload. Heaving type of apical impulse, tell me one pressure overload condition?
Aortic stenosis.
Aortic stenosis. Hyperdynamic type of apical impulse, tell me volume overload condition? MR and AR. MR and as well as AR.
Yeah.
And in case of hyperdynamic type of apical impulse, where will be the apical impulse? Is it in the same position or shifted?
Shifted.
Shifted. Where it is shifted?
Down, lateral.
Down and out. Down and out. Now you may ask me, sir, why is it shifted down and out? Because in volume overload condition, the left ventricular size, it increases. So that is the reason why it will be shifting down and as well as out. Okay? So that is about the apex of the heart. Is it clear? Right. Now, What is this particular area of the heart called?
Base.
This is called base of the heart. This is called base of the heart. And this will be the apex. So apex is formed by which chamber of the heart?
Left ventricle.
Left ventricle. Now, within the base of the heart, you see how many structures are there? Right?
Yes.
Right? There is pupa. All like many structures are there. Okay? So you have atria and you have the great vessels as well. You have atria and as well as the great vessels. So all these you have within the base of the heart. Okay? Right. Now we will try to go to the great vessels later after discussing the chambers first. Right? So now let me discuss the chambers. So this will be your left ventricle. This will be your left ventricle. Then you may ask me, sir, how do you make out this is left ventricle? Why this is not the left ventricle? How do you make out?
Apex.
That is by the apex. So right ventricle, you will not have the apex which is protruding out. Whatever is protruding out will be your left ventricle. So this will be the left ventricle. So obviously what this will be now?
Right
This will be your right ventricle. And what is there in between this here?
Interventricular
This is
septum.
the septum. That is interventricular septum. Okay. I will tell you the importance of that. I will show you the chambers. Then I will discuss the clinical aspects. Like as I have discussed about the apex clinical aspect, I will discuss the clinical aspect of the chambers and as well as their surfaces also. Right. Then followed by that, what is this particular structure?
Left auricle.
Yes. What is this?
Auricle.
What is this structure?
Auricles.
Yes, can you see this? What is this I am showing? So this will be your left auricle or left atrial appendage. This will be your left atrial appendage, which is the extension of the left atrium. Extension of the left atrium. Okay? Right. So I have shown you the two chambers. Right? Are you happy with these two chambers? No problem? Right. Now, this is your right ventricle. This will be your right ventricle. Okay? Now, do you want to see the right atrium as well? Yes? Okay. Now, yes. You see this. So you have a small structure here. Can you see this? Huh? Yes. So this will be your right atrium. This will be your right atrium. Is that clear? Right. Now, after having shown about the chambers, now let me. Right. So, after showing the chambers, let me discuss the importance of these particular chambers. Okay? What is the clinical aspects of these particular chambers now? Now, so we will come from the ventricles because ventricles are the one which are very important structures which does lot of work to our body. Now, among these two ventricles, which particular ventricle will be more thick? Left ventricle will be more thick. I will cut it and show you. I will cut it and show you how the left ventricle will be and how the right ventricle will be. And the next important thing you need to know, why left ventricle is more thick than compared to that of right ventricle.
Pressure.
Why?
Systemic circulation is starting.
Because the left ventricle has to pump the blood into aorta. Aorta is at very high pressure, whereas right ventricle has to pump the blood into pulmonary artery, which is the low pressure area. Right? How much is the maximum pressure in the aorta? What is the maximum blood pressure that can be there?
250.
That is 120, or it can be even up to 140. That is in aorta. Whereas in pulmonary artery, how much is the maximum pressure that can be? That is only 20 millimeters of mercury. In pulmonary artery, maximum pressure is only 20. Whereas in aorta, the maximum pressure is up to 140. You understand that? So, your left ventricle has to pump the blood into a pressure area which is up to 140. Right ventricle has to pump the blood into the chambers which is only 20 millimeters of mercury. So that is the reason why which will be more thick?
Left ventricle.
Left ventricle will be more thick. Okay? Right. So let us cut it and see now which is thick and all we will see. Right. So let me just cut this particular left ventricle now. Right, so what I am dissecting now is the left ventricle. Right. So I have just given a cut and I'm trying to squeeze through the layer of the left ventricle and I'm trying to enter into the left ventricular cavity. And always, whenever you are catching a scalpel, right, you should not catch the scalpel like this. Okay? You should not catch the scalpel like this. Okay? So you should catch the scalpel like a pen. You should catch the scalpel like a pen. Okay? Right. And so let me dissect more where I can enter into the left ventricular cavity. So left ventricular cavity, as I have said you, it is the thickest layer. Right. I have entered into the left ventricle. Okay, yes. Okay. You see the thickness?
Yes.
Yes? Can you see the thickness now?
Yes.
Right? So how thick is this your left ventricle? You see? Now, I'll compare this with the right ventricle. So I said you, left ventricle will be more thick than compared to that of the right ventricle. So now, let me show you the right ventricular thickness as well. So, but before going into the right ventricle, do you want to see like what is there in the left ventricle? Yes or no?
Yes.
Are you all interested?
Yes.
Only few yes.
Yes.
Yes? Yes. Very good. Now, so if you take the left ventricle, you have all. I said you within the heart there are three layers. What are those three layers, please? Endocardium, Myocardium, and Pericardium. So these are the three layers, right? So now let me try and show you those three layers first. Yes. So if you can see, this one is your endocardium. The innermost layer is your endocardium. Can you see one demarcation is there? Are you able to appreciate that? No? I'll try and dissect it. So, exactly right. So, yes. Can you see the pointer which I am pointing to one particular layer here? Is that, are you able to see the pointer? Yes. So, this particular pointer which I am placing is over the endocardium. It is over the endocardium. You see, this entire thing is your endocardium. And can you see this muscularity? Yes, that is your myocardium. That is your myocardium. Okay? And you have a layer above. Can you see this particular white layer? So that will be your pericardium, which is present above the myocardium. So these are the three layers: endocardium, myocardium, and pericardium. Now what is there, right? So what are all these? What are all these white strands? What are all these white strands? These white strands are all what? They are all caudate tendinae. They are all your caudate tendinae. You see this? These are all white strands is your caudate tendinae. Now, let me tell you the story of this particular caudate tendinae. So, you have in between left atrium and left ventricle, what is that you have?
Tricuspid.
Left atrium and left ventricle. That is mitral valve. So mitral valve, it has two leaflets, right? So that is anterior leaflet and posterior leaflet. So now this anterior and posterior leaflet, it is connected to, they are connected to the endocardium, right? And how are they connected to the apex or the inferior surface of the heart? How are they connected is by your caudate tendinae. So you have the cusp, anterior and mitral leaflet. Through this anterior mitral leaflet and posterior mitral leaflet, you have the caudate tendinae. Right? The caudate tendinae are the strands, and these are those particular strands. So if you see this white color structures, these are the caudate tendinae. And the caudate tendinae, they will go and insert. Where do they insert, or what is this? What is this muscle? That is called papillary muscle. So now you have the anterior and posterior mitral leaflets. You have the caudate tendinae down. and then you have a papillary muscle down where the caudate tendon is being placed. So this will be your papillary muscle. So this is your papillary muscle. Okay? Now, so do you want the upright aspect of this? Yes?
Yes.
Right. So everyone is aware of myocardial infarction. Everyone is aware of myocardial infarction? Yes or no?
Yes.
Yes. So this myocardial infarction, you have the various types depending upon which wall is affected. Like for example, you see how is your heart? It is like a three-dimensional structure. It has an anterior wall. It has a lateral wall. It has an inferior wall. It has a posterior wall. Understood? Now, your anterior wall of your myocardium is supplied by left anterior descending artery. So I said you about the coronary circulation. What are those two coronary arteries?
Left, right.
Left and right.
Right and as well as left coronary artery. Right coronary artery originates from right coronary sinus. Left coronary artery from left coronary sinus. What are the branches of left coronary artery?
Left circumflex artery.
Left circumflex and left anterior descending. Now, the left anterior descending, it supplies over the anterior surface. Left circumflex, it supplies over the lateral surface. Okay? And I will try to demonstrate that particular vessel also for you. I will try to demonstrate that left anterior descending artery for you. Okay? So, if you can see, this is like the fact what you have over
Abducens.
pericardium. And if you dissect this pericardium, exactly underneath that, you will be able to, yes. Can you see this white color luminous structure? Yes, can you see this luminous structure here? So this will be the anterior, left anterior descending artery. You can see, this is all your left anterior descending artery which is passing down. So it will start all the way from aorta. This is the aorta here. From the aorta, from the left coronary sinus it originates. That is left main coronary artery, and it will divide into left anterior descending artery and left circumflex artery. Okay? And this left anterior descending artery is passing over the interventricular septum. And it also has the branches which are supplying, you see these are the branches. So these are the branches from the left anterior descending artery. So does anyone know what are the branches of the left anterior descending artery? What are the branches of the left anterior descending artery? Anyone of you please? What are the branches of the left anterior descending artery? Yes. So the branches of the left anterior descending artery is the septal branches which will supply to the interventricular septum. Okay? And then these are your diagonal branches. Right? Are you able to appreciate these branches which are passing down?
Yes.
Yes or no? Yes. So these are the diagonal branches which are going to your anterior wall. So now you see the division. Ascending aorta, left coronary artery and right coronary artery. Left main coronary artery again divided into left anterior descending and left circumflex. Left anterior descending again, what are the branches of left anterior descending?
Diagonal.
Septal and diagonal branches. Now what is the clinical aspect? The clinical aspect is that if this particular left anterior descending artery is blocked, the individual will develop which type of MI?
Anterior.
The individual will develop anterior wall MI. The individual will develop anterior wall MI. Do you understand that? Now, suppose if the left circumflex artery is blocked, right? I will show you the left circumflex. Right? So, can you see one more vessel which is passing down here? One vessel which is passing down and it is giving the branches. Can you see these vessels?
Yes.
That will be your left circumflex. So, if this particular left circumflex is blocked, the individual will develop lateral wall MI. The individual will develop lateral wall MI. Now, then followed by that, so the importance of this particular MI is that whenever this myocardium is dead, right? Whenever the anterior wall is dead, what happens is this caudate tendineae, the caudate tendineae and papillary muscles which are attached Because your myocardium is dead. Once your myocardium is dead, the caudate tendon and as well as papillary muscles which are attached to the endocardium gets ruptured. Once they get ruptured, your mitral valve, can it stay in the place? No. So it will prolapse into the left atrium, and thereby the individual will develop what is called mitral regurgitation. Thereby the individual will develop what is called mitral regurgitation. So is it clear about your now? But the only thing what I have left out is the valves. I will show you the valves. But before that, let me show you the thickness of the right ventricle. So I have shown you the thickness of the left ventricle. Now let me show you the thickness of the right ventricle, and then followed by that I will show you the valves. Right. So what I am dissecting now is the right ventricle. And always you have to catch a scalpel in the form of a pen, and the direction of this particular sharp edge should be away from you. You should not be dissecting like this, right? Maximum time you have to dissect like this. Why? Because you will not be puncturing yourself, right? Or you will not be having a cut. So when you do like this, so it will be outwards. So that is the reason why I am trying to cut towards outer side. Right, you see this. This is the beautiful right ventricle. Okay? Yes. Now you see the difference. This is your right ventricular thickness. And this is your left ventricular thickness. So are you able to appreciate the thickness now? Right? So which is more thick? Left ventricle is more thick than compared to that of the right ventricle. Okay? Now in the right ventricle, do you have caudate tendinae or not? You have caudate tendinae. And you have the papillary muscles there also. Why? What does this caudate tendinae and papillary muscles do? They hold tricuspid valve. They hold the tricuspid valve. Now let me try to demonstrate that. Yes. Right. So you see these white structures. Are you able to see this? Right. So this will be the caudate tendinae, right, which are going. They're actually down. So are you able to see these white color structures? Right? So these are the caudate tendinae which are going and getting inserted into the papillary muscles. Okay? So, and at the same time, I will also show you the valves as well now. Right. So, now, so this will be the right ventricle, what I am showing you. These are the caudate tendinae, right? And they are inserting over the papillary muscles which are present on the right side. So I am trying to show you the tricuspid valve. So in the tricuspid valve, how many leaflets will be there? 3. So there will be totally 3 leaflets. Now I will try to show you all that particular 3 leaflets of the tricuspid valve. One second, I will just try to dissect this. Yeah. So now we have discussed that there are totally 3 leaflets. Okay. Now, so this is one particular leaflet of the tricuspid valve, which is there in between my left thumb and as well as the index finger. Right? Can you see this? Yes. This is your one valve, and yes, and and just beneath that you have another valve, this one. Can you see this another valve? Right? And this is, and then you have, this is your posterior leaflet of the tricuspid valve, and this will be your septal. So are you able to appreciate all these? And whatever the extensions you are having down, what is this particular extension? These are your caudate tendineae. So if this particular caudate tendineae is being ruptured, what is the abnormality the individual will develop?
Regurgitation.
This will be tricuspid regurgitation. And on the left side?
Mitral regurgitation.
Okay. And where are they inserting? Where is your caudate tendineae inserting? What is this muscle? So this will be your papillary muscle. Now, so you see here. Now, which particular valve of the tricuspid valve is this? This is your septum. So why am I using the word septum? Because it is connected to the interventricular septum. It is connected to the interventricular septum. Is that clear? Now, so the point is that this entire structure is your interventricular septum. Okay? So this is on the left side and this is on the right side. So if I place this particular pointer, so now how did I make out that this is the septum? By your septal valve of the tricuspid valve. By your septal valve
Of the tricuspid.
By the septal valve of the tricuspid valve, I could make out that this is the septum. Now, so like how can I doubly confirm? Okay, before doubly confirming, I want to discuss the blood supply of the interventricular septum. So can anyone tell me what is the blood supply of the interventricular septum? Blood supply of interventricular septum. That is
Septal.
just now we have discussed.
Septal branch.
That is from left anterior descending artery.
Yes.
Left anterior descending artery, it has the septal branches.
Yes.
And the septal branches of left anterior descending artery, it supplies the anterior two-thirds. It supplies anterior two-thirds. And right coronary artery, it supplies the posterior one-third. So now this interventricular septum has the two supplies. What are those two supplies?
Septal
Anterior
branch.
by left anterior descending artery.
Yes.
Posterior by the right coronary artery. Posterior one-third is by the right coronary artery. So now, if I pierce this particular pointer, so where it has to enter to? It has to enter to
Left
the
ventricle.
interventricular septum. Yes, you can see, and it has entered into the left ventricle. Okay, you see this? This will be your left ventricle. Left ventricular lumen I am inside. And where I have passed, this will be the right ventricular lumen. Okay, so this is about your ventricles and papillary muscles, caudate tendineae, and as well as skull. And I did not show you the mitral effects, I'll show you now. And this is your left ventricular thickness, and this is your right ventricular
thickness.
Okay. Now I'll try to show you, demonstrate the mitral valve. So how many valves will be there within the mitral valve?
Two.
So two. What are those two?
Anterior, posterior.
Anterior as well as
Posterior.
the posterior, right? So you see how beautifully they are being placed. Right. So are you able to see this? This is one and this is second. Right, I'll show you. So this is anterior mitral inflate. Can you see this? Right? And this will be the posterior mitral inflate. Yes. So now I hope you are able to appreciate now. Is it clear now? So this is your anterior mitral inflate and this is your posterior mitral inflate. So these are the two cusps of the mitral valve. And what are these strings? Caudate tendineae. Where are they attached to? Papillary muscles. They are attached to the papillary muscles. And for suppose, if this particular caudate tendineae is being cut, what will happen?
Mitral regurgitation.
The individual will develop mitral regurgitation. So because it is the caudate which are holding these particular cusps. And if this caudate tendon is cut, the cusps cannot be in the same position. They will prolapse into the left atrium, resulting in what is called mitral regurgitation. And what are the conditions where you can have this caudate tendon rupture or papillary muscle rupture is in case of anterior wall myocardial infarction, you can have the papillary muscle rupture, and inferior wall MI, you will have the caudate tendon and papillary muscle rupture. Is that clear?
Yes.
So this is about the story related to your ventricles, right? So shall I quickly recap in 2 minutes like what we have discussed?
Yes.
Right. So among the right ventricle and as well as left ventricle, which is more thick? Left ventricle. Why it is more thick? Because it has to pump the blood into the aorta, which is greater pressure, rather than the right ventricle pumping the blood into the pulmonary artery. Right? That is one thing. Then in the right ventricular lumen and as well as left ventricular lumen, what are the important structures that you will see? What is this? This will be your caudate tendon. And where are they placed over?
Papillary muscles.
Right? And what is this particular structure? So what is this structure? Which fiber is this? Right. So anterior and as well as posterior mitral leaflets. Okay. Next, coming on to the right side. Okay. So and within the right side, right. So what are these white color strands? Caudate tendon. So how many leaflets will you have? 3. What are those 3? So anterior, posterior, and then septum. And this will be your interventricular septum. So interventricular septum is, what is the blood supply of the interventricular septum? Septal branch is from LAD, and we have the posterior interventricular branch of the right coronary artery. Anterior 2/3 by
Septal branch of
left
LAD.
antidescending artery. Posterior 1/3 by
Right coronary artery.
right coronary artery. Right? Now, so in another just 10 or 15 minutes, I will finish the atrium. Right. So this is what is your the left atrial appendage. This is what is your left atrial appendage, and then you have the left atrium. So now I'm trying to enter into the yes. Now left atrial appendage. What is the importance of the left atrial appendage? The importance of the left atrial appendage is that if there is any thrombus formation within the left atria, thrombus means clot. The clot formation will occur within the left atrial appendage. So now left atria, it has 2 structures. As such left atria, and it has an extension. And that particular extension is called left atrial appendage. And the clinical importance of this left atrial appendage is the thrombus, the clot will be there within the left atrial appendage. And this particular clot within the left atrial appendage will shower in the form of an emboli. What is thrombus? What is emboli?
Emboli were plugged out
What
from
is
thrombus.
thrombus? What is emboli? Thrombus means the clot which is fixed to the vessel.
Yes.
That is thrombus. Embolus is the same thrombus. If it is floating, then it will be your embolus. That will be your embolus. So now the point is, now where will be the thrombus is in this left atrial appendage. From this left atrial appendage, the thrombus whichever is formed can go in the form of emboli. Now what are the conditions where you will have the thrombus formation in the left atrial appendage? That is, we have one particular abnormal heart rate rhythm that is called atrial fibrillation. In atrial fibrillation, you have the thrombus formation within the left atrial appendage. Okay, that is the importance of your left atrium. Clinical importance of your left atrium. Okay, right now. So if you take this left atrium, right. So what are the vessels which will be opening into the left atrium? What are the vessels which will be opening into the left atrium? That will be your
Pulmonary vein.
pulmonary veins. Now let me try and demonstrate this particular pulmonary veins. So how many pulmonary veins should be there? So there should be 4 pulmonary veins. Okay, right. So I'll show you that. See, my finger is from the left atrium, right? Whichever I have placed is from the left atrium. So this is one pulmonary vein, right? And this is another pulmonary vein. If you see here, can you see this?
Yes.
1, 2, and then we have 3, and we have 4. This one. 1, 2, 3, and then 4. So these are the 4 pulmonary veins which are opening into your left atrium. So pulmonary veins, where do they get blood from?
Lungs.
They get the blood from the pulmonary capillaries. Pulmonary capillaries, where do they get blood from?
Alveoli.
Pulmonary capillaries, where do they get the blood from? From the pulmonary artery. See, right ventricle will give rise to your pulmonary artery. Pulmonary artery will further divide into pulmonary capillary. Pulmonary capillary will at the level of pulmonary capillary, the exchange of gases will occur in the lungs. And at the level of after that, from the pulmonary capillary, the blood enters into your pulmonary veins, and through the pulmonary veins, the blood will enter into your left atrium. So from the left atrium, the blood will enter into left ventricle. From the left ventricle, the blood will enter into the aorta. Right? So now, let me show you the aorta now. Okay? So aorta, where it will be the extension from? It will be the extension from
Left.
the left ventricle. You see, in which ventricle have I placed my hand now? That is the left ventricle. Now, when I pass my finger from the left ventricle, you see, where is my finger coming from? Or, like I just pass this pointer, okay? Right. Yes. So, can you see this? What is this structure now? What is the structure through which the pointer has come out?
Aorta.
This will be the aorta. This will be the aorta. Okay. So, and how to make out? Sir, this is aorta. How to make out is because aorta, is it a thick wall structure or a thin wall structure?
Thick wall.
Aorta is a thick wall structure. You see how thick is your aorta? Can you make out this thick aorta?
Yes.
So this will be which part of aorta now?
Ascending.
This will be the ascending aorta. This will be the ascending aorta. Is it clear?
Yes.
So are you able to make out the great vessels on the left side?
Yes.
4 pulmonary veins I have shown you. Then I have also shown you the aorta which is coming from the left ventricle. Okay? And in between the left ventricle and as well as aorta, what is the valve? Aortic valve. That I cannot demonstrate because that will be thin walled, and once the individual is dead, they get merged into the aortic valve. Okay? Right. So this will be your aorta, which is a very thick wall structure. Now, then you take, what is this chamber? What is this chamber? That will be your right ventricle. Yes? Now, what? So what will be the extension of the right ventricle?
Pulmonary artery.
The extension of the right ventricle will be pulmonary artery. Now, how to make out the pulmonary artery? So what we will do is, we will pass this particular pointer through the right ventricle and we will see where it is coming out from. Actually, the entire tissue is there. This is your
Collapsed.
pulmonary artery.
वहाँ पे टिश्यू रहेगा.
Right. So the structure what I am cutting now is your pulmonary artery. Right? So how to make out that this is pulmonary artery? I will show you.
बहुत दिन यहाँ कटा. ठीक है, यहाँ मार दम सार.
Right? The structure what I am dissecting now.
Sole medica. मेंबर ओनली कर दीजिए ऐसे कमेंट के.
Right. Now I just pass this. So I am passing the pointer through the right ventricle, and you see. Yes. So what is this structure now?
Pulmonary
This will
artery.
be your pulmonary artery. And now, what is this particular pulmonary artery? So, right. So, this, if you can see that the pulmonary artery is divided. So, this is the main pulmonary artery. This is the main pulmonary artery which is coming from the right ventricle, and it is dividing into two. Right? You can see that. So, it is dividing into the left pulmonary artery here, and as well as the right pulmonary artery here. So these are the two pulmonary arteries. So left pulmonary artery, where it will go? It will continuous towards the left lung and continuous the left pulmonary capillaries, and right pulmonary artery towards the right lung and then the right pulmonary capillaries, where the oxygenation of the blood will occur. Right? So this is about the right-sided structure. That is right ventricle. And what is this small structure? What is this small structure? This will be your right atrium. So what are the vessels that should open into the right atrium? What is this structure? What is this structure?
Superior
This
vena.
is your superior vena cava. They have cut the inferior vena cava. It is not there here. But whatever you are seeing here is the superior vena cava, which is opening into your right atrium. Right? So this is about the vessels and as well as the valves. Right? So I hope I try to demonstrate all the structures. Left atrium, left ventricle, and I have cut that. I have shown you the chordae, papillary muscles, and as well as the mitral valve. And on the right side, I have shown you the right ventricle and as well as the right atrium. And I have cut that. I have shown you the chordae and as well as the tricuspid valve. And along with